thank you guys for coming. I appreciate you being here for this. You know, it's really kind of important. Justin and I, I'm the assistant chief here of Clear Creek, and I were just talking about that falls are really kind of that number one thing that we see in our emergency rooms and what they go on a lot of times. And so, like I said, I'm really glad that you guys are here, and I hope that you take away some good information. Some of this might just be kind of like that review for you, but there might be other things that you might be able to take away here. So I am Ann Brock. I am the Trauma Outreach Coordinator at Atrium Medical Center. We're the Level 3 Trauma Center there in Middletown. Just a little bit of background, I've been a nurse for 34 years. I was a firefighter paramedic for the City of Monroe for 25 of those years, when I then had to medically retire, and I ended up taking the position that I am in now. So, and just Trauma Outreach Coordinator, it just is a real fancy title for injury prevention, community outreach, education, injury prevention kind of stuff. So, but without further ado, let's get started. So this is SLIP. It stands for Senior Lifestyles and Injury Prevention. This actually came about by the Michigan Trauma Council. And they just realized that there was a need for a class, just a real generalized class to help you guys with some of the just fall prevention kind of things. So that is how then this class came to be. And just bear with me here. I thought I had my technology down, but I guess I did not. There we go. So some of the objectives, we're going to talk about just the growing epidemic of falls, the cost of those falls, and not only the financial cost, but then also the physical and the mental cost that kind of goes along with that, right? And then factors that kind of increase your fall risks. And then we're going to talk about some fall prevention strategies and then how to fall-proof your home. Now, I will tell you that this is, like I said, it's a very generalized, generalized talk. But now I also do offer, if you guys were ever interested, and we were even just kind of talking, it's a 7-week course. It's free. It's 2 hours each week. And we come and we talk to you guys about different fall prevention things. So 1 week, all we do is talk about medication and how medication increases your risk. 1 week is all home safety. 1 week is vision and footwear. So like I said, that is a free class. If you guys were ever interested in something like that, I don't know, I did not bring a card with me, but maybe we can get a hold of Maureen and see if there would be any interest there. So, yeah.
Where would that take place?
It would actually, it's a good question, because it couldn't take place here, because you actually need a little bit of room to be able to do the exercises that we teach you. It's a good question. I'm sure that we could probably come up with something. Yeah. We'd find something, so. All right. So, this is just statistically speaking, 1 out of 3 Americans age 65 and over will have a fall. Now, those are the ones that are actually reported. There are a lot more that actually go unreported. You know, and it's really one of those things that if you fall in your home, maybe you were feeling a little dizzy, or it was a trip over a rug, let your provider know about those things. It's just good for them to have that information as to how they can then kind of go about, maybe if it is you're dizzy because you got up too quick, do they need to maybe readjust your medications? Or is there something that they can suggest to you, maybe some physical therapy, or, and after this, I hope that you actually are either A, taking your rugs out of your home, or B, you're actually taping them to the floor. But, so just all of those kinds of things. But it's really a good thing to let your provider know when you have taken that fall. Falling down is not a normal part of aging. You hear that so much. Oh, I'm just getting older, so of course I'm going to trip and fall. Oh, yeah, I didn't see the dog this time because my vision's bad. It's just because I'm old. No, falling is not part of the normal aging process. Yes, physically things change, but it is not normal for you to fall. So just ask yourselves these 3 questions. You don't have to answer them out loud, but have you fallen in the past year? Do you feel unsteady when you stand or walk? And do you worry about falling? Just some fall facts. Falls, and like I was just saying earlier, it's the number one thing that we see coming into our emergency rooms, are falls. And so many of those falls then lead to just a whole bunch of other complications down the road. How many of you know a friend that maybe has taken a fall and they're just not the same after that fall? Anyone can fall, and the risk of fall, of course, increases with age. But like I said, it's not normal to fall. And at age 80, there will be half of the seniors that have actually fallen annually. And I'm not going to read through a lot of this, but you can just kind of see from this slide that what kind of some of those physical things that kind of happen after a fall, right? Women are 3 more times to actually suffer hip fractures because of the fact that once we go through menopause, we have a lot of hormonal changes that, starts kind of down that road for calcium deficiencies and vitamin D deficiencies. But men actually will die from that fall. So cost of falls. So like I said, the physical suffering, maybe it is a fall and you lay there all night before somebody finds you. So now you're laying there, maybe you're cold, you're in pain. So just that physical suffering. The mental anguish of, hey, you know what? I have fallen. Now I don't want to walk anymore. I don't want to go outside. I don't want to go see my friends. I don't want to, because of the fact that we have fallen and we're afraid of falling again. Confusion, just, is this a head injury? Maybe you hit your head, or once again, if you're not getting out and being social, then you kind of start down this whole path of being depressed, not really caring what day of the week it is anymore, all of those kinds of things. There's difference about being retired and not caring about the day of the week, right? As opposed to being depressed and being confused about those kinds of things. So, and then also just that interruption of your lifestyle. All of a sudden you were independent, and now all of a sudden you've maybe broke that hip. Now we're in the hospital for a couple days, we're not in our same bed. Maybe then we've got to go to a short-term nursing facility for some rehab, so we're still not at home. So there's just a lot of the disruptions in your own day-to-day lives. So some of the factors that can increase your risks of falls, there's a lot of them up here, and I'm only going to kind of go through a few of these. But the effect of medications is a big one. Maybe you're taking your Lasix pill at night, your water pill at night, and now you're running to the bathroom to get to the bathroom before you wet yourself. Maybe talk to your doctor about changing that to go to the morning. Or maybe you have increased your blood pressure medication, and every time you sit up, it's making you dizzy, and you're not taking those few minutes just to sit on the edge of your bed or to sit on the edge of your chair before actually then getting up. So just, those kinds of things. Then also kind of down further, right, we've got your sleeping pills, maybe taking that pill to help you go to sleep, those water pills, the blood pressure medications. And there is, I think it is check your risk for falling, and I think that one or a couple of those in there have the about your medications. Vision impairment is another one. Vision impairment is a normal part of aging. The eye itself starts to change. So you might have those from going from light to dark. Might be a little bit more difficult. So if you remember in that first picture, right, as they were the stairs descending, it got darker, it was light to dark. As we get older, you may not see that as well. So taking that into account when it comes to basements, having maybe a light at like the top of the stairs that also then lights the entire way down those stairs. Or coming in from the garage, same kind of thing. Just having, making sure that you have the lighting there to take care of those things. Then pets can also be another one. I'm a big pet lover myself, but I don't know how many times I've heard, oh, my cat tripped me up, or my dog tripped me up, or, that kind of thing. So just to kind of watch for your pets. The last one that I do want to bring up out of this is ladders. How many of you guys have heard the commercial? What sends people to the emergency room more often? It's not, but it's actually living in your basement. Has anybody heard that commercial? And they're actually talking about ladders. And the fact that people don't use ladders correctly. They're either getting they're either getting all the way onto that top rung, or they don't have it secured correctly. So that's a big one. If you do have maybe that neighbor that can help you change that light, or putting things down to where you can actually get to them easier, as opposed to even on that step stool, getting up and down off that step stool. So just, these are just kind of some of those tips. I know that probably a lot of this is review for you guys, right? But trying to minimize some of those hazards that maybe you do have in your home. Even like your area rugs, right? And like how she was saying, don't trip on this rug as you go out, okay? Area rugs are horrible. I know they look pretty, and we love to have them in our homes, but they are probably a big part of that fall, and you slip and fall on that rug. So if you do want to have them in your homes, please make sure that you are getting some of that double-sided tape, or the rug tape that so you can actually tape down your rugs, your area rugs. And then just kind of change some of those behaviors that maybe you have kind of going on, taking a little bit of extra time as you get up out of bed, or not rushing to get to the phone, or not rushing to get to the bathroom, or whatever that might be. Just trying to kind of slow it down a little bit and just kind of look around you as to what's kind of going on. So, of course, we all age, okay? And the aging process can have an effect on how our body moves. It changes our vision, how we hear, physical. We kind of start to shrink. We have the chance then of the osteopenia, osteoarthritis. Our reflexes slow down. And then we're also put on more medications, it seems like, as we do get older. So some of those medications can cause dizziness. I hope that you guys are looking at your bottles to actually see whether or not that medication is causing dizziness or not. And like I've said, trying not to get up that real quickly. It's called postural hypotension. And what happens is that your blood pressure just drops real quick. So you're getting up and your blood pressure takes a drop, and now you get dizzy and you fall. Limiting your alcohol intake, especially if that medication does say that alcohol can affect how that medication will affect you. Excessive earwax. People don't take this into account, but our ears, nose, all of this is kind of combined. So if you have maybe a lot of earwax in those ears, that can also make you dizzy. So that's one of the reasons why to tell your doctor, hey, look, I've been dizzy. Because it might be a medication or it might be something physical, just some excessive earwax in your ear. And guess what? You get that ear cleaned out, and now we don't have those dizziness problems. Inner ear infections and UTIs. UTIs can affect, especially women, it seems like more than men, that we can actually become a lot more confused. We aren't acting the way that we should. We're not acting normal. But yeah, UTIs or urinary tract infections can really have a lot of problems with falling and being dizzy. Keeping your bones strong, and we'll talk a little bit more about this a little bit further into the presentation. And actually, one of the handouts that I did give you is all about osteoarthritis and calcium. And we'll go into recommendations here in a little bit. But a lot of times where we're seeing these calcium losses are in the spine, the hip, and the arms. And if you think about when we fall, right, we're either falling on our butts, which then we end up with some spinal fractures, or we're falling forward and we're trying to brace ourselves, now we break our arm, or we're falling down on our side and breaking the hip. So those are the three places where we see a lot of that loss of calcium. So, of course, the proper diet, the triangle has changed so much over the years of, how much of what you should have and all of those kinds of things. But it really is important to keep yourself properly hydrated, as well as a good diet. A good diet especially will help you if you do take that fall or that fracture. Extra protein will help you heal a little bit better than just, not doing that. And it really does kind of help prevent that injury. Hydration, water. Make sure that you guys are drinking enough water throughout the day. You really should be trying to get in that 8-ounce glasses of water a day to keep yourself properly hydrated. So we want diets rich in calcium. And that, like I said, the one handout that I gave you has a lot of examples of what you can eat. Leafy greens. If you aren't a big milk person, I'm not, but now I like yogurt and cheeses. Those kinds of things. And try to balance that diet. And if you maybe you only eat one meal a day just because I'm not feeling hungry, try to at least get in maybe a couple of those nutritional shakes. The Boost, there's a lot of them out there, right? There's Boost, there's Premier Health, there's Premier Shakes. It's not Premier Health, but it's Premier Shakes. Ensure, any of those kinds of things. And this just is kind of showing that kind of progression from that normal spine, maybe at about 18, then we've got middle age, and then older age. And we really do kind of start to kind of hunch over with some of those, the loss of calcium in our spines. So here is the recommendations. The calcium really does help with slowing down some of those age-related hormone losses that we see out of bone. Women should be getting 1,000 milligrams up to the age of 51, I believe, and then it goes to 1,200. Men should be at about that 1,000 up until the age of 70, then they go to 1,200. So here's just some examples of some of those things that we can get. And are any of you guys any good at reading your labels? You read labels when you go to the store? Okay. So just kind of looking at milk and those kinds of things just to see how much calcium is actually in those things. Calcium supplements, of course, always consult your doctor before you just start taking a calcium supplement. Maybe one of your other prescription medications, excuse me, one of your other prescription medications might interact with that calcium if you would just start taking it on your own. So just make sure that you're consulting your doctor before you would want to start taking a calcium supplement. Also, some of those calcium supplements might have other things in them, maybe some magnesium or some vitamin D. So there are those supplements that are out there as well. Excuse me. So here's the vitamin D recommendations. And why is vitamin D important? The fact that you need the vitamin D to actually get the calcium into the bone. So just because you're taking this calcium, if there's no way for it to get into the bone, then it's really not worth taking. So we should be also making sure that we're getting enough vitamin D into our body every day. The sun is the best way to do that, but you know what? We live here in Ohio. We don't get a lot of vitamin D through the winter, do we? Not a lot of sunlight. So you may very well have to take that supplement. Once again, ask your doctor to make sure that we're getting enough in our diets. There are other ways, though, of getting some vitamin D. Eggs are a great one, Cheerios. This is the one that I can't believe it's not butter. Did not realize that it's got vitamin D in it. And then fish. So salmon, I know, is a great one. Trout, those are a couple of the really high in vitamin D. Any questions so far? Good pace, going too quick? Good? Okay, all right. So we want to try to minimize a lot of those, the ways that we do or that we can fall. One of the medications, of course, have your doctor or your pharmacist go over that list every year, your primary doctor, because it's gotten better because of the fact that a lot of the doctor's offices now are computerized. But it used to be you would go see your heart doctor who would put you on something. Then you'd see your diabetic doctor that would put you on something without knowing what the cardiac doctor has you on, right? And then you go to your primary doctor, and your primary doctor puts you on something else, and nobody was talking to each other. So there were a lot of times where you were put on a medication that was completely interacting with whatever else one of your other doctors had put you on. It's gotten a little bit better because of the fact that so many of the offices now are computerized, that they talk to each other. But it still is really, really important to go over that list with your primary doctor at least once a year. And even that pharmacist, depending on wherever you go, I know you can even go to the Kroger's or CVS, that those pharmacists love to have those conversations with you. It's the reason why they have that consultation window, that, hey, maybe you're being put on an antibiotic for a cold, or not a cold because they don't do that. I don't know, antibiotic for a swollen finger. There we go. And so you're put on this antibiotic for your swollen finger, and go to your pharmacist. As you go in to get that medication filled, say, I'd like to speak to the pharmacist about this because he also then has all of your other medications and can tell you whether or not that is going to react with one of your other medications. They are a wonderful resource for those things. You might even have a better relationship with your pharmacist than your doctor. So, I mean, just to, like I said, one way or the other, make sure that we're reviewing those medications with one or the other. So try to improve your strength with some exercises. I believe in the My Mobility plan. It has a lot of just really good resources, and I believe that one of the things they talk about in there is exercise. Also in the bone health, they talk about exercise. You should really try to do some stretching kind of exercises every day of the week, and then those strength exercises at least 3 times a week. And once again, with that Stepping On program, there are several exercises that we do teach you guys, both balance and strength. So have awareness of what's kind of going on. Look out in front of you. If you're walking down the sidewalk and you see that maybe the crack in the sidewalk. So, oh, shoot, there's a crack there. Kind of walk over it. Or trying to, if there's especially someplace that maybe you aren't aware, or that you're new to, you're not, oh, shoot, the curb's right there, kind of thing, right? How many of us have kind of missed that one step as we're kind of going down the step because we didn't realize that it was there, or we just miscounted, or we're in a hurry and just misplaced that step. So, and then use your walker or your cane. This is where I'm going to call on this gentleman here because he has seen it a lot of times that I have. You want to?
Absolutely. Hello, everybody. My name is Justin Bueller. I am a Assistant Chief of Risk Management for Clear Creek Fire District and also the City of Springboro. But yeah, so as Ann stated, this is a very common injury that we see out in the field. There are lots of instances where this happens every year, and we as paramedics and EMTs, we respond out to these emergencies, and we do everything that we can to help. But really, the prevention of this is what we're trying to bring awareness to. Each year, when these things happen, people suffer all different types of injuries. Sometimes people fall and they just lose their balance and maybe they hurt their skin a little bit. Sometimes they have a head injury. Sometimes they'll even break a bone. Just out of curiosity, has anybody here ever fallen down? I have. Yeah. So, and the truth is that what we want to do is try to change the way people kind of view this problem here. As we get older in life, and I kind of like to break it down to freshmen, sophomores, juniors, and seniors, right? I'm in my junior year right now. But as we start to get up there are some things that change. And sometimes you have to make an investment in your own safety, right? And a lot of times, some of these small changes, gaining some of this knowledge about picking up the rugs and things like that, those types of changes are really about protecting you and keeping you from falling. A conversation that I'll have often with people is, part of growing older in life is that you need help as you get older. Now, how many people here are looking forward to living in assisted living or a nursing home, right? Not many. Everybody wants to maintain their independence, myself included. But the truth is when you fall down and you break your leg or you break your hip, if you don't have family at home that can care for you, that is where you go to recover until you can get better enough to come back. And my wife, Miss Kelly, she's a 5'2" little spark plug, but she can't lift me in and out of the bed and do things like that. So I would have to seek that type of help as if I were to become injured. So by keeping those things in mind and getting help where you need it, if you need help mowing the grass, or maybe sometimes it's just as easy as rearranging where you keep your cleaning supplies. A lot of people like to keep them underneath the kitchen sink, and when they squat down to get them out, they get dizzy and they fall over and hurt themselves and things like that. So a lot of times there's minor changes and a little bit of knowledge that you can obtain to kind of help keep yourself safe and avoid some of those scenarios that lead to you becoming injured and having to seek additional help. So does anybody have any questions for me about falls in this area? One of the most common things is that people will need alert bracelets and things like that, a way to call for help. I can tell you there have certainly been times where people have fallen down and they don't have family in the area, and they'll lay there for a day or two before somebody comes to check on them. And that could be a really scary situation. So making sure that you have access to communication and that you have people checking on you and all that good stuff is certainly very helpful. So,
All right.
but we are located right down here on Main Street. If anybody ever had any questions about fall prevention or need any help with that, feel free to call the fire department and ask for Chief Bueller. I'll get you pointed in the right direction. Everybody, they all call me Ferris Bueller, so I'm sure you guys have seen that. So just ask for Ferris, and I'll be able to get you pointed in the right direction. So thank you very much, everybody.
Thanks, Chief. And once again, kind of some of that prevention might be using that walker or that cane, and to continue to use it every time. And I'm sure he can tell the stories as well as I can of going to a person's home in the middle of the night, they've fallen in the bathroom, but yet their walker's in the bedroom because they thought that they could get to the bathroom without needing their walker. That you're using that assistive device for a reason. So make sure that we continue to use those things. And you might not want to, and also that we're using them correctly. Seeing somebody like this over their walker when they should actually be up nice and straight are two different things. Or using that cane and they're all hunched over. Once again, that's a great time to maybe ask your doctor, say, okay, maybe I'm not using this cane correctly. Can you show me the right way? Or can you refer me to an occupational therapist or a physical therapist just for a session or two to make sure that I'm using my assistive devices correctly. So, and once again, just your medications. Don't ever take somebody else's medication. We're probably taught that from a young age. Don't be taking somebody else's medication. Just as important from when you were a teenager to now. Just because you maybe have the same swollen finger and your neighbor down the street has some leftover antibiotics doesn't mean that you should take them, okay? So just make sure, like I said, that you're reviewing those medications with your doctor, your pharmacist, and they're a great resource there for you to have. So like I said, there is that home safety checklist in your packet of stuff that I gave you guys. Use that when you go home today. And just see what changes you might need to make in your homes to make it just a little bit more fall-proof, to be able to keep you guys in your home a little bit longer. Know your limits. That's a big one. Maybe you decide, you know what, it's a pretty day today. I'm going to go out and I'm going to walk 4 miles. You walk 4 miles and you're like, oh gosh, now I got to walk 4 miles home, right? But how many of us have actually gone out and walked 4 miles in the last couple months, right? So know your limits. You know that, okay, yeah, I might want to walk 4 miles, but I'm not going to be able to get 4 miles in the day. Maybe it's only, okay, I'm going to walk up the street, a couple houses down and then back. Just kind of know your limits. Even you're cleaning out your home. Take, just a little bit extra time each day. Maybe, okay, I'll do the bedroom today and I'll do the kitchen tomorrow, as opposed to trying to get it all done in just one big sweep. Because it seems that when a person is more tired is when you don't have that same awareness of what's kind of around you. Staying physically active, once again, without the exercise, it does a lot of things. You end up with a lot more heart conditions, and it really, really is a good for bone and strengthening of your muscles, and to keep you from falling. Staying socially active, that is a real big one. That for that mental aspect, by all of you guys here. I mean, that is that kind of that social interaction, all of you here. How did I start this off with, right? That is one of those costs of a fall, is that mental anguish, because now we don't want to get out and we want to stay in our homes. Now we get depressed. And that kind of just starts this whole downward spiral of a decline. So just really trying to stay active, no matter what that might be. Is it you just getting out and going down and talking to the neighbor, or going to the senior center, or coming to these every Tuesday of the month, first Tuesday of the month. Not first Tuesday, third Tuesday of the month, sorry. It isn't the first Tuesday, is it? Once again, make sure that we're using those walkers and those canes. It's just really, really important for you guys to do that. So, and I did just real quickly just want to talk a little bit about traumatic brain injuries. Traumatic brain injuries happen because as we age, our brains start to shrink, but our skull doesn't go with it. So we actually end up with some space in our skull where our brain should be. And so what happens when we fall is that we can cut one of those either arteries or veins in our brain, up here in our brain, and we can then bleed. Those chances of bleeding increase if you are on that blood thinner. So maybe you're on Plavix, Coumadin, aspirin, warfarin, Coumadin the same. So that really does increase. And if you aren't going in and having those blood counts done on a regular basis, that blood level could, or that the blood, how thin your blood is, could actually then get to be, that you're super, super thin. So important, once again, to be going in and getting those blood levels. But these are just some of those symptoms that come along with a traumatic brain injury. A little bit of confusion. Maybe you go over to a neighbor's home and they're just not acting right. Man, this isn't the way that Joe acts every day. And so ask him, have you fallen? Or ask his wife, have you fallen? Because that can very well be one of those signs of a traumatic brain injury. The other thing that goes along with this, if you do live alone, have a signal, I guess, for maybe a neighbor. Say, I turn off my light, my garage light every morning after I get up, or I open up the drapes every morning after I get up. So if we aren't seeing those drapes open by 9 o'clock in the morning, why don't you come over and check on me, right? Kind of make a little bit of sense, okay? That way that you are getting checked on by somebody if you are living alone. Because, especially these traumatic brain injuries, the longer that you lay and the longer that we now have this bleeding going on, can make that even that more difficult to fix. So just really kind of important to kind of keep some of these symptoms in mind. If you would fall, or your husband would fall, your wife would fall, or a neighbor. So, all right. And that is all that I got for you guys. Get any questions for me? Any questions for Chief Bueller? No? All right. Well, I appreciate your attention. Thank you. So that's all I got.